Hey everyone, welcome back to the channel. So today what I'd like to talk about are hamstring injuries. So whether that's a pulled hamstring, a hamstring tear, a hamstring strain, whether that's a hamstring tendon injury or a hamstring tendonitis, it can be anything to do with hamstring injuries. As a physical therapist, I get asked a lot just the simple question of how hamstring injuries occur. And the way that we look at it, I think, is a little different to how we should be looking at it. In my experience, and this may sound strange, but it seems to be the case, is that every single hamstring injury, every single hamstring tear, every single hamstring strain, and all other hamstring issues should be considered a back issue first until proven otherwise. And what I mean by that is, clinically what we see with hamstring injuries or hamstring tears is that low back dysfunction pulls function from the hamstrings and sets them up to fail when they do. So whether you're playing an athletic sport, whether you just bend and twist and something goes wrong, or you have an accident and you suddenly hurt your hamstring in the moment, what's really important to understand about hamstring tears are that the moment that it happens is the last straw. It's not the start of something brand new, even though it feels that way. So if you are running or sprinting and you feel your hamstring ping or your hamstring tear or pop, it's very easy to feel like that was the moment that it failed. And it is the moment that it failed, but you didn't go from being perfect to injured in that moment. You went from slightly less dysfunctional to slightly more dysfunctional, and that was the threshold that your hamstring tissue could no longer tolerate. So I think I see this a lot, particularly with my, as an Australian, my country's home sport of AFL football. We have a really high number of hamstring injuries in that sport. And those hamstring injury rates haven't shifted over the last 10 to 12 years, despite us being better at rehab. Modern medicine has, advanced a lot in terms of rehab. Strength programs are better. We have all these protocols in place to hopefully heal hamstrings and get them stronger and prevent hamstring injuries. But the ultimate reality is that hamstring injuries are still very common, and we haven't necessarily chipped into those injury rates as much as we would like to. And I think the reason for that particularly is that as a profession or as an industry, we tend to look at hamstring injuries as a failure of the hamstring in isolation, where we think that your hamstring wasn't strong enough, maybe it wasn't loose enough, maybe there was something else going on in the hamstring that caused that to fail. When in actual fact, we need to take a step back and put it into context of the lower back. And once we do that, I think we'll see more easily why hamstrings occur and also what we need to do to stop them from coming back. So if you'd like to hang around to the end of the video, I want to make sure that I'll show you a quick test that hopefully highlights how important the role of a good functioning spine is in hamstring function. But before we get to that, I just want to quickly touch on, I guess, the mechanics of how the hamstring and the back relate to each other. Now, it's important to understand that when I talk about back dysfunction, again, you don't have to have any of the big name items like a disc bulge or a nerve root issue, arthritis, stress fractures or anything like that. From what I see clinically, all you need to have is stiffness, tightness, and deactivation, or not poor core strength, but poor activation of your core muscles. And why this is so important, and it's a fundamental element that we see with a lot of lower limb injuries. If your back is dysfunctional, it pulls function from your hamstrings in sort of two main ways that I see to prioritize the stability and the function of your spine over the peripheral function. So your body cares more about your central components with your trunk, your spine, your spinal cord, than it does with your legs, essentially. And that makes sense. So I think, again, to reiterate that point, if you have any hamstring dysfunction, you've got to make sure that your back is functioning normally, otherwise you probably won't conquer it. You may not, if you've torn your hamstring once, you may never tear it again. But if your back is dysfunctional, most likely without you realizing it, then there's, I guess, the potential for that hamstring issue or even tight hamstrings to be there for a while. So again, when we talk about that low back function, and we're not talking about the big ticket items like a disc bulge or a nerve root issue or whatever it might be, your back doesn't have to be painful. As I said, we're looking for joint stiffness, deeper joint stiffness, overloaded tissue, tight muscles around that spine and in and around that spine. So again, you don't have to have pain. You don't even have to realize that you're stiff and tight. But when you test it out, or when you have a physical therapist or someone push through the joints of your spine, it's highly likely that they'll be able to find some stiffness in those joints, stiffness that you didn't realize that you had until somebody went looking for it. So basically what that means is that if your spine is a little bit stiffer and a little bit tighter than it wants to, the two ways, I guess, that the hamstrings get involved here is, the first one is through the sciatic nerve. And a lot of people know that the sciatic nerve comes from the base of your spine. It goes through your glutes, that piriformis area, and it basically comes down the back of your leg towards the back of the knee. And why this is really important is that if the area that your sciatic nerve originates from becomes tight and stiff, it's kind of like winding up that nerve a little bit. So if it's stiff and tight, instead of that nerve being able to floss freely sort of out of the spine and down through the muscles and the tissues of your hips and legs, it all of a sudden becomes more taut. So there's more neural tension in the system. And from what I find clinically, what your body tends to do is, once you pull some of that neural slack out of the hamstrings become tighter to help support that dysfunction. So if you're someone who constantly has tight hamstrings, it's not that your hamstrings are naturally tight or they just happen to be tight for whatever reason. They're tight because, without you realizing it, your back has asked them to be that way. So that increased neural tension can create some extra tightness around that nerve, or in and around the areas that the nerve passed through, and it sort of increases that resting tension through your hamstrings. So if you then take those tightened nerves, tightened tissues into something dynamic like sprinting or kicking a ball or something like that, or overstriding, for example, then your body has less of a buffer or a lower threshold to pain and injury. So we often see that neural tension is increased, and then the muscle becomes torn, or you pull that muscle, strain that muscle, or if it's significant, you can rupture that, or can rupture the tendon, or pull the hamstring tendon from the bone. Whatever it is that tends to happen, that increased tension tends to be there potentially beforehand. So that's number one, that increased neural tension. The second one is an interesting one, and this is what I want to highlight, because it's probably easier to show you this than it is to say it, but we'll talk about it first just to see. The second thing that tends to cause hamstrings to become dysfunctional is decreased stability or decreased activation of the muscles around your spine. So again, your body prioritizes the support and the stability of your central components, that central spine, to the detriment of the tissues around it. So what we tend to find is, if your core muscles don't activate well, and again, this is a different conversation to core strength. Core muscles need to be able to kick in at the right time and to kick in at the appropriate moment, as well as having that power and that brute force and that brute strength as well. But one of the things that we see is that you can have a fantastic ability to produce core strength. You can be really strong in a lot of core exercises, but it doesn't count for as much if your body doesn't use those muscles at the right time. And I'll talk about at the end of this video, I guess, how your back generally becomes dysfunctional and how the core muscles deactivate. And it's a really simple idea and something that you can change very quickly. So hang around to the end of the video for that. But the important thing that I want to get across here is, if your spine and the muscles of your spine, your core muscles, become deactivated, your body needs to find that extra stability from somewhere. And whether it be through the sciatic nerve or the hamstrings attachment to the pelvis, your body can tighten up and stabilize the system by increasing that tension in your hamstrings. So, and again, the exercise that I'll show you in a second will highlight this, but if your body doesn't stabilize your spine well, it tends to draw that sort of stability from your hamstrings. Again, decreasing that resting mobility, increasing that resting tension. So if you've got some neural tightness and some stability issues through your spine, then it just increases that potential for a hamstring injury. And I think the reason why this is missed so much is that those two features don't necessarily have pain or covert dysfunction attached to them. Yes, you may feel tight, but we don't register that as a threat. A lot of people feel tight and we don't necessarily worry too much about that, even though we know that we probably shouldn't be. So if your back doesn't hurt, if you don't feel anything going wrong there, there's literally no reason for a lot of people to go looking for it. But what we find is that when you do go looking for that, we can start to increase the function of those hamstrings and decrease the risk of pulling a hamstring, tearing a hamstring, straining a hamstring, tendon stays safe, all the things that tend to go wrong with that tendon. We can optimize and upregulate that function by improving the function of your spine. So the movement that I want to show you guys here is it's a very simple exercise, but I'll show you the difference between a spine that's not braced and a spine that's braced. And you won't be able to see this, but I'll talk you through it. So basically it's a straight leg raise. So you can do this yourself at home, is if you can lie down on the floor, straighten one leg out, and then lift your other leg up to about 90 degrees and hold behind that thigh. And all I want you to do here is, without moving this thigh and keeping your foot pointed out for this one, I'll get you just to straighten your leg as far as you feel comfortable without moving your thigh. So just go up as high as you feel comfortable. So that's probably the end of my range just here. Now what I want you to do here is have a look at where your toes are in relation to the roof or the wall. And just remember that, because we're going to come back to this and do it again in a second. So the next thing that we want to do here is we want to brace that spine. So for people that know how to do this, if you find the bony bumps at the front of your hip and come in from that, you'll feel a fleshy part of your abs. If you dig deep into that, this is where you'll feel those core muscles activate. And to activate those core muscles, all you need to do is take your breath in, and then as you breathe out, you want to draw that belly button in towards your spine. And if you've done that correctly, you should feel those muscles gently tense and activate underneath your fingers. It's separate to a squeeze, which is a sit-up type movement where you're squeezing those muscles and all the superficial muscles on the top become really tense. It's a deeper sort of in and up feeling, and you'll feel some light activation of that muscle. So what we want to do here is we want to get back into the same position again, and we want to activate those core muscles, so draw it in and up. And then what you should find is when you lift that leg up again, it should automatically go further than before. And because what you've done here is, if I release those core muscles again, I'll just come back up. So that's as far as I feel comfortable going. I can't really push that any further. If I draw those muscles in again, so I'm drawing that muscle in, and all I'm doing again is just straightening my leg, and it just feels like I have extra movements to give. And what this does, and hopefully if you go back to this video, you can see that my leg got to a certain point and then it got a little bit further second time round once it activated. So just so you don't have to take my word for that, please try it yourself, because if you can understand how those core muscles stabilize your spine and gives you a more functional platform to lift your leg, it takes some of the onus off those hamstrings. So for anyone watching this who has had recurring hamstring issues, you want to understand how hamstring injuries occur. If you're at a high level club and you're trying to find new ways to solve that hamstring problem, you have to start at the lower back. You have to make sure that your patient or yourself can brace their spine effectively. You also have to make sure that their back is loose and mobile. So those joints need to fray up, that nerve needs to fray up really well. And if you don't have those things going for you, it's very hard to fix hamstring injuries. So with that being said, as we said a little bit before, the last thing that I wanted to touch on here is how it gets to this. How does your spine become dysfunctional? How do those core muscles deactivate despite having good strength? And the answer is not that interesting. It's something that we talk about a lot on the channel. But one of the most important things to understand about hamstring issues and the role of the back in determining those hamstring issues is that poor sitting shapes are significant. If you sit in a bad shape often enough and for long enough, you're going to set your hamstrings up to fail, full stop. What we see with a lot of young athletes, we still spend a lot of time, particularly elite athletes, you can spend most of your week training and getting fitter and stronger, but when you're not training and getting fitter and stronger, we need to figure out what positions you're putting your back into. So if you're someone who works a lot sitting at the computer, if you are a younger athlete and you spend a lot of time playing Xbox, or you're hammering through Fortnite at the moment, any length of time that you're spending in a bad shape increases the load wherever that hinge goes. So if you sort of sit back in the chair and you're hinging through your back, it increases the resting load through your spine. and it asks those tissues to toughen up, to get stiffer and tighter to cope with that load. Without you realizing, without you asking that to happen, that's what happens. The other thing is, in those relaxed slashy postures, you're not using your core muscles, or many muscles for that matter, to hold you in a good position. Most of the time you're just resting on the passive tension of your joints, of your deeper soft tissues like your capsules. You're not actively holding yourself in a good position, which is the whole reason why we slouch, to be fair, to take that pressure off. So you can spend hours a week toughening up your core, getting stronger through planks and football exercises and Pilates and yoga and all these sorts of things. But if you're doing that for, say, 1 hour a day, and then you spend 5 or 6 hours straight after that in a bad shape, you're not using that core strength at all. And then your body's ability to recognize when it needs to activate gets diminished. So I guess to follow this all the way through, in summary, what I find clinically as a physical therapist is, if anyone has any hamstring dysfunction, there's going to be some back-specific things that have to get better in terms of mobility and activation, strength as well, depending on the person. But all of this, the reason why we have this conversation is generally because of our bad sitting habits. So if you want to be someone who used to have a hamstring problem or used to have tight hamstrings, you have to be someone who's now good at sitting, basically. So it's not sexy, but if you can't sit in a good position where you actively hold yourself, or you prop something into your back to keep yourself in a good position, then you're not solving the problem. And we're always going to keep having this conversation of how hamstring injuries occur, because we're not taking a step back and understanding the mechanics and what your body prioritizes over your hamstrings, which is that central spinal dysfunction. So hopefully that was informative. Hopefully it wasn't, I didn't ramble on for too long. So as always, if you did find it useful, please leave a like below. If you enjoy this content, please consider subscribing as well. The way that YouTube works is for these videos to get out to more people, for this information to spread, we sort of need that interaction and your support. So if you found it useful, please interact and let us know. Comment below with your thoughts on this. I'd really love to hear what you have to say. But until next time, we'll see you then. Bye.